Hello, good afternoon, everyone. My name is Renu Chandwani. I'm your host for today, and today we are going to talk about a very important and very famous topic these days, which is doing rounds between social circles, social media, people of all age, creed, color, sex. So this is about the miracle drug called Ozempic, right? There are more such drugs which are available in the market, which people are highly taking now for weight loss. Apart from being a diabetic drug, which is used for the treatment of diabetes, it is now largely used for the weight loss. It is also available in the market by the name of Ozempic, Mounjaro, Wegovy, Zepbound, and many others. So we are here with Dr. Prashant Jerath today. He's an MBBS MD doctor, and he is going to facilitate us to understand what this drug is all about. So welcome, Dr. Prashant.
Thank you, Renu ma'am. Thank you, entire audience, for such a warm welcome. And I'll be basically talking about Ozempic today.
Ozempic, all right. So, sir, what is Ozempic? Let's start with the very basic question. What actually is Ozempic and how does it work for the weight loss?
Ma'am, Ozempic is basically a molecule. Ozempic has a molecule called as semaglutide in it.
Okay.
Semaglutide is a molecule that basically mimics a hormone called as GLP-1.
Okay.
And GLP-1 is basically which bounds to GLP-1 receptor, and basically it does not lead to, it leads to delay in gastric emptying.
Okay.
And basically we are not able to eat that much.
Oh, okay.
So basically that semaglutide is a kind of hormone that resembles a natural hormone called as GLP-1.
Oh, all right, all right, all right. So it basically suppresses the appetite. That's what you're saying.
And basically what Ozempic does, it mimics that regular hormone and
Okay.
basically suppresses the appetite.
Ah.
So it leads to a suppression of the appetite. Our gastric delaying is emptied.
Okay.
So basically we are not able to
Eat that much. Ah, okay, okay, okay. So basically, what we need to do in the diet, eat less, is what this is helping out with.
Yes.
Okay, but sir, is it approved for weight loss?
Ma'am, Ozempic comes with various names. It is also comes with the name of Wegovy and Mounjaro.
Okay.
Basically, Wegovy and Mounjaro are basically approved for weight loss.
All
Even
right.
Ozempic used in higher concentrations is used for weight loss.
Okay.
So yes, it is approved for weight loss. It is basically approved for diabetes. It's a diabetes drug,
Okay.
but it is also used for weight loss, and it is also used in some other conditions.
All right, all right. And how much weight do you think, or is expected to be lost by using this drug? So if somebody weighs like 100 kgs, so what is the kind of weight that he's looking at for losing?
Ozempic, persons who have started using Ozempic,
Yeah.
usually in 2 to 3 months or over a period of 1 year, they basically shed 10 to 15% of their body weight.
All right.
So people who are taking Ozempic regularly for more than a year, like
Okay.
we have been seeing various celebrities who have lost a lot of weight.
Yeah, yeah, right.
They have had drastic weight loss.
Yes.
So either they are taking Ozempic, Wegovy or Mounjaro, or they are lying about it.
Okay, that's a huge claim.
So thing is that either they are on Ozempic
Okay.
or they are lying about it, as I told.
All right.
So you can basically lose up to 25% of your body weight
Oh,
by
really?
using Ozempic or Wegovy or Mounjaro.
Okay, but over a period of time.
Over a period of time, yes, of
Okay.
course, over a period of time.
Okay, okay, okay. And how exactly does it come? Does it come in the form of pills or injections or how? And what is the dosage for that, sir?
And basically, what right now I'm holding in my hand is a pen of Ozempic.
Oh, this is it, is it?
Yeah.
Okay.
It's a pen of Ozempic. Basically, it comes in a dosage of 0.25 milligram,
Okay.
0.5 milligram, 1 milligram, and 2 milligram.
All right.
Higher doses are available for Wegovy and Mounjaro also.
Okay.
So basically, it is a kind of injection, right? So basically, each injection has basically 4 injections in it. So each injection, this whole pen can be used 4 times. So it comes with a disposable needle.
All right.
You basically just have to disconnect the needle every time. So you can just take it in your skin, like we take any insulin drug, like
Right.
we take insulin.
Okay.
So people who are taking insulin will better understand this, because
Understood.
that insulin also comes in the same kind of a pen.
Okay.
And it is to be taken the same way. So it
Okay.
can be taken in stomach, it can be taken in arm, it can be taken in thigh.
Okay.
So all these things, this Ozempic can be taken. It's a basically
It's not
injectable
painful,
form.
this thing injecting?
No, absolutely not. Ma'am, the needle is so small, sometimes you will not even feel that it is inside
Oh,
your
really?
skin.
Okay.
So it can be taken, it is
Easily done at home.
self-administered injection.
And you said it is to be taken once a week, right?
And basically it is to be taken once a week, and each pen like this basically lasts for 4 weeks.
Okay, so about a month's
It's
dose.
a month's dose.
Okay.
So
And then you
basically,
have to take it again.
you have to take it
What
again.
happens if we miss a dose?
Ma'am, if you miss a dose, then you can take it. If you remember it within 1, 2, 3 days, you can take it definitely.
All right.
And we do not recommend doubling of dose. By doubling of dose, what I mean is if you miss it for a week and then you remember it after a week that today is my dose due, but last time I missed one dosage,
Right.
then we do not suggest you take two dosages. You take only one dosage that time.
So, just to make it short, like if I take it every Sunday, and if I say forget on a Sunday and then I remember on a Friday, then I should not take it on a Friday. I should take it on
You
the
should take it
following
on a
Sunday.
following Sunday, and that too
Ah,
single dose. This dose that
single
was
dose.
recommended to you.
All
Like
right.
this pen is 0.5 milligram,
All
right?
right.
So you will take 0.5 milligram again, not 1
Okay.
milligram.
Okay. Okay. And sir, who decides on this dosage? Because as you say, there are a lot of dosages that come. So, how do we go about the dosage part?
About the dosage part, we always recommend the patient to follow with the doctor first before starting Ozempic, before doubling the dosage of Ozempic, or before weaning off the dosage of Ozempic. For all three things,
Okay.
means it has to be always taken in prescription of a doctor,
Okay.
and you should always consult your doctor before starting Ozempic because there might be some nausea, vomiting, diarrhea, and
All
common
right.
complications which you may face while taking Ozempic. So it is always recommended that you consult your doctor before starting it.
Okay.
So
Okay.
it has to be
So the
taken.
doctor only will tell you how to go
Yes,
about the
the doctor
dosage.
only will tell you what is the dosage of Ozempic.
All right.
You should not just go to a pharmacy to buy Ozempic and just start administering it on your own
Right.
because it is a medically prescribed drug.
Okay.
So it has to be taken in prescription with the doctor.
With the doctor. Okay. Okay. That's great. And sir, as you said, like you might come across a lot of complications. Are there any side effects for this medicine?
Ma'am, practically there are not much side effects for Ozempic. Ozempic, the major side effects are nausea, vomiting, diarrhea, and few patients may face constipation also.
Okay.
Because the reason for constipation is basically it delays gastric emptying. So when gastric emptying is delayed, so some patients may face this constipation issue, but generally there are usually these side effects are not faced in the patient.
Okay.
Some rare patients, I would say, like very few patients, they experience their pancreatic enzymes such as amylase and lipase are elevated.
Okay.
So in those cases, either weaning of Ozempic is required,
Okay.
or in that cases, this dosage has to be lowered, or the patient has to stop Ozempic. That depends upon the decision of the doctor.
Right. So once again, it is important to take it under a doctor, not
Yes,
not yourself
prescription of a
off the
doctor. Yes.
prescription. Okay. 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 And so, can anyone take Ozempic? Is there an age factor, or is there a any other requirement that this person cannot take Ozempic?
It is always recommended that we take Ozempic after 14 years of age. It should not be started in children.
All right.
Right?
Not in
Like
children.
if the children is a
Okay.
little plump or is overweight, then you
Yeah.
should not start it in children. Any age after 14, and there is no upper limit. It can be started in any age. If the patient is 80 years old and he's
Okay.
morbidly obese, Ozempic can be started in that.
All right.
It can be started at any condition. He is having any condition, the patient can take Ozempic.
All
He
right.
can start it for resistant weight loss.
Okay.
He can start patients who are exercising daily and not able to lose weight. They can start it.
All right.
Patients on thyroid who are not able to lose weight, they can start it. Patients with PCOD, females specifically, and they are not able to lose weight. We have seen this a lot. Then they can start Ozempic. And people with lifestyle issues, like
Right.
I have a sedentary lifestyle. I'm a doctor. I have to sit in the OPD all the time. I'm not able to lose my weight.
Correct.
Those patients can start it, and immobile patients can start it. By immobile patients means patients who are not able to move. I have arthritis in my
yeah.
knees.
Yeah.
I have some problem. I have some disability, and I'm not able to move that much. I'm not able to exercise that much. Those patients can start it. So it can be started in almost every kind of a patient for weight loss, diabetes, and all other things it is recommended for.
Right. So more or less you've covered like half the population out there, because half of us are suffering with this, with lifestyle problems or the issue and the weight problem, or the weight goes and comes back. So that's always a struggle in life. So how long does it takes to see this weight loss effect? So suppose somebody starts taking Ozempic today, how soon will he see the effects?
I mean, the best part about Ozempic is it's kind of a miracle drug. Once you administer the dose of Ozempic, within 48 hours, 24 to 48 hours, you'll start feeling its effect.
Yeah.
Some
Right.
people have come to us and reported that they have lost 1 to 2 kg in first 48 hours. Okay. And over a period of 1 week, the ideal result starts coming.
Oh,
And people lose around 2 to 3 kgs in first sprint.
wow.
And over a period of 3 months, 6 months, or 1 year, whatever the recommended or desired weight loss is, people are able to most of the times achieve whatever is the desired weight
So you
loss.
think somebody who needs a quick weight loss for a wedding or a shoot or something can also go for this?
Definitely, ma'am. People who are in show business, like
Yeah.
influencers, I'm talking about influencers,
Yes.
models,
Yeah.
and people who they have to look slim for their job, right?
Correct.
Specifically, those people can look at if you are planning for a wedding or something
Yeah.
like that, and a month before or 2 months before you plan a desired weight loss,
Yeah.
so you can use Ozempic.
Yeah.
Definitely, you lose
Hey girls, we
over a
have
period.
good news here. Yeah. Okay,
Yeah.
great.
So you
So,
can, but you
sir,
have to plan ahead.
of
Yeah.
course. So what happens once we stop taking this?
Ma'am, once you stop taking this, if you are not maintaining a healthy lifestyle,
All
right,
right.
the weight will come back because of your lifestyle, not because of Ozempic. It does
Okay.
not have any habitualization. It does not mean your body is going to be dependent on Ozempic. Your behavior may be, but not your body.
Okay.
Because if you do not do exercise, if you do not maintain your weight, if you do start eating like that much and you do not
Yeah.
exercise, again you have a sedentary lifestyle,
Yeah, yeah, yeah.
then again the weight is going to definitely come back. It's not like it's
Right.
going to go forever.
Right.
But if you are taking Ozempic, that desired weight loss will be there. You have to maintain your weight after that.
Okay.
I am 100 kg. I have achieved a weight of 75 kg. But after 75 kg, I have to be more mobile.
Correct.
I have to do exercise. I have to maintain my weight. I have to do healthy eating,
Okay.
and that is how the weight is going to maintain. And there is no habitualization of Ozempic. It means after you leave Ozempic, it is not going to come back because of
Right,
Ozempic.
right. So basically, it is highly recommended, or it is equally important that while you're doing that weight loss with Ozempic, it is very important to change your lifestyle, start taking a balanced meal, and shift your lifestyle from what you had to what
Absolutely,
is
ma'am.
just required, right?
Absolutely.
Okay, that's great. So any other contraindications of this drug or long-term side effects?
Basically, there are not much contraindications of this drug. Basically, it should be used with the prescription of the doctor. First thing is that. Second, it cannot be used in certain cases, very rare cases. The multiple endocrine neoplasia is a condition in which it should not be used because semaglutide causes more allergy in those patients.
Right.
And it is also not used in medullary carcinoma of thyroid. Those are very rare conditions,
Okay.
and they are specifically, it is contraindicated in those patients. Otherwise, there is no such contraindication or any patient in which this Ozempic cannot be used.
Okay.
So it can be basically used over a broad spectrum of people who want to lose their weight, people who are on diabetes and they are not able to shed their weight, and it is because basically used in type 2 diabetes.
Right. So once again, important to consult your doctor before you start taking it. Do not just buy off the shelf, right? So basically, you're saying even if I'm not a diabetic, I can take Ozempic.
Yes, ma'am. Any person can take Ozempic, even if you want to use it for weight loss, right? Any resistant weight loss you have, any exercising condition you have, you're not immobile, you are basically having thyroid or PCOD, any patient can take this.
Right. So what about any food restrictions or anything with Ozempic?
Ma'am, there are particularly no food restrictions with Ozempic. Basically, it can be used along with any foods.
Right.
Like I told you before, even if you are taking junk food, you can take Ozempic and you are going to lose your weight.
Right.
Right? Healthy, it will always promote. If you are taking a healthy food, it will definitely promote weight loss, but it is not a mandatory requirement.
Right.
If you are not exercising, it's not a mandatory requirement
Right.
of
Right.
Ozempic.
Okay.
With Ozempic, if you are taking Ozempic, you are going to lose your weight.
Okay.
But then that depends upon you. How will you
How
maintain
will
that
you
weight?
maintain that
And
weight?
definitely, if you have a healthy lifestyle and if you are exercising, you lose more weight.
Okay, I understood. Yes, yes, yes. So fine. So all you guys and girls out there, good news. Wonder Drug is here. Go and try it. But yes, definitely, definitely contact your healthcare provider or your doctor and do it under his guidance, his or her guidance only. So yes, you can use Ozempic for weight loss. Of course, it's a diabetes regulating medicine. but you can use it for the weight loss. That's a good news for people out there who really finding it difficult to lose weight or are struggling with weight through all these years. So thank you, Dr. Prashant, for all your support and guidance. And if you have any queries, ladies and gentlemen, so please you can put it in the comment box, and we will be happy to get back to you. And of course, I'm your. We look forward to many more such interactions with the doctor, and any other queries we'll be happy to comment on or reply on. So I'm your host Renu Chandwani, and thank you, Dr. Prashant.
Thank you so much, ma'am.
We
Thank you
will,
so much for
yeah,
this
yeah.
entire interview and enlightening our viewers about Ozempic.
Yes, I'm sure a lot of people out there
Yes.
are looking for solutions like this, and we'll be happy to help. Yeah.
Thank you so much.
Thank you. Thank you, everybody. Thank you.